Alrighty, let's get started. Welcome and thank you for attending this webinar hosted by the National Pesticide Information Center, also known as NPIC. My name is Kaylin Chang, and I'm an NPIC pesticide specialist and currently serve as the database quality control specialist. Before we start, just want to review a few logistics. We will be recording today's webinar. The recording will be available on both the NPIC website and on our YouTube channel. We'll send an email with links to the webinar once it's posted, likely by the end of the month. If you have questions during the webinar, please use the Q&A box that you see at the bottom of the screen. Questions will be addressed after the presentation portion concludes. Finally, please keep yourself muted during the presentation. Our speaker today is Meredith Cox, the project coordinator for NPIC. She was a former NPIC pesticide specialist who served as the database quality control specialist for several years. We also have with us Sean Ross, who is NPIC's pesticide inquiry database developer. Meredith, Sean, and I will answer any questions that come into the Q&A box at the end. With that, I'll turn it over to Meredith.
All right, thank you, Kaylin. All right, and everyone can see my screen all right? Perfect. Okay, so thanks again for joining me today. Today's webinar is going to have 4 different components. I'll go over them real quick. First, I'm going to give a quick review of what the National Pesticide Information Center is, in case we have attendees who are not familiar with us. And then I'll give an overview of our data, including how data are collected and what types of data we collect. After that, I'll discuss a bit about what we consider a pesticide incident here at NPIC. And finally, I'll close up discussing the process for how to request NPIC data. There we go. All right, so who is NPIC? Let's start. We refer to NPIC as the National Pesticide Information Center. We refer to us by our acronym NPIC. So I'm going to be referring to us as NPIC throughout the presentation rather than using our full long name. NPIC is a cooperative agreement between the US EPA and Oregon State University, and we've been operating at Oregon State University in Corvallis, Oregon, since 1995, when we were known as the National Pesticide Telecommunications Network. I say we, I was not involved at that time. Since then, NPIC has handled over 500,000 inquiries about pesticides and related topics from the public and professionals. NPIC provides objective, science-based information about pesticides and related topics to help people make informed decisions. And the main way we accomplish this is through our information hotline. Our hotline operates from 8 a.m. to noon Pacific time, Monday through Friday. But of course, we also take inquiries by email, and now we do also take inquiries by social media as well. And if you leave us a voicemail or send an email, we will respond to you within 1 business day. We do also have an extensive website, and increasingly that's becoming a very important way and one of the main ways that the public is getting information from NPIC. We have hundreds of different pages that present science-based information about pesticides in an easy to understand manner. So an example of a typical inquiry to the NPIC hotline might be this. Someone calls because they are about to have a pest control application in their home. Maybe it's something their landlord ordered for them. And they found out the product that's going to be used, the name perhaps, and they're calling us asking for information about risks that product might pose to themselves, their family, or their pets, something like that. So when someone calls the NPIC hotline, they're going to be immediately connected with one of our 6 pesticide specialists. All of our specialists are trained in evaluating pesticide risks to people and the environment and how to translate those risks. So how to translate the technical jargon in a way that's going to be understandable to someone without a scientific background. Our specialists might also brainstorm ways to reduce the risk of a situation, ways to reduce exposure. And we do offer services in multiple languages. So in addition to the 2 bilingual Spanish-speaking pesticide specialists, we also contract with Language Line Solutions. And this is a translation service, phone-based translation service that offers translation for over 140 languages. I'm sorry, 240 languages. So they can pretty much handle it all. And so the type of information NPIC specialists discuss with callers is going to be tailored to the question at hand, but the kind of information you might expect to hear includes things like signs and symptoms in the literature, the chemical properties of pesticides, pest control topics, especially IPM, ways to reduce risk and exposure, and general label guidance. And in addition to that, we also take care in directing callers to outside agencies or organizations when they might be able to add to or complement the information that we are giving callers. And NPIC also has a number of things that we cannot provide people, and we like to be upfront with our callers about those boundaries. So first off, we cannot provide any application information. We can't interpret a label for a caller by giving them application or mixing instructions in the place of that caller locating the information for themselves on the label. So we might provide assistance in how to navigate the label, help them figure out where to find information on their label, but we are ultimately going to refer them to the product manufacturer for those application instructions. Next off, we don't provide any legal advice or medical advice. And if someone is seeking medical treatment or evaluation by a medical professional, then we're going to refer them to their doctor or poison control center. And importantly, NPIC is not a regulatory agency, so that means we don't have any enforcement or compliance authority. We also don't conduct automatic reporting of our call information to enforcement agencies. However, we still do assist callers when their concerns are regulatory. But we're careful to discuss with callers what our role is and what it is not, including who the proper authority is for a situation. And we always provide them with the contact information for the appropriate regulatory agency, usually the state lead agency, when that seems like the most appropriate contact for them. And we maintain a database of a directory of contact information for all 50 states. We call it My Local Resources, and you can find it here on our homepage. So here's a screenshot of our homepage. And that little map, you can click on that to open that screen on the right, and that's our My Local Resources directory. And if you click on your state, you'll find a list of many different organizations with their phone numbers for your state. So state lead agency, but also other state agencies, OSHA, county extension office, vector control, and more. And I will ask you a favor following the webinar to please go to our website and click on there, look for your organization if you're here today as part of an organization, and make sure that we have your contact information up to date. We do our best to do quality control to keep that information up to date, but obviously that's a continual process. So it'd be great if you could help us out on that front. And so who is NPIC's audience? So our database consists of all the inquiries placed to NPIC by phone or email. So understanding our audience can give you a good idea of the kind of inquiries that we have in our database. And the majority of NPIC callers year after year tend to be from the general public. We have a pretty steady number, about 90% year after year seem to be calls from the general public. And by that, we mean someone that's calling on behalf of a problem in their day-to-day life. The remaining 10% are professionals, and that means the purpose of their call is, they're calling on behalf of their organization or because of something that's happening in their workplace. So that could be a farmer with questions about tolerances or regulations. It could be farm workers with exposure concerns, or teachers with questions about disinfectants used in their classroom. But because 90% of our callers are calling our general public, it does follow that most of the questions we get to our hotline are questions about pesticide use in and around the home. So now that I've briefly introduced NPIC, we'll dive more into the data, which is I know why you guys are here. So what constitutes NPIC data? What information do we collect, and how do we record information? So when I'm talking about NPIC data, I'm talking about the database of all inquiries made to our hotline or via email. And we document key elements of all of those conversations and enter them into the custom-built database that we call the Pesticide Inquiry Database, or PID as we refer to it. And we describe key elements of all those conversations by applying data codes to them, but also by writing up a written summary narrative that accompanies those data codes. And before I move forward, I want to emphasize that NPIC is self-reported information. So the limitations of NPIC data they're similar to other organizations that collect self-reported information because we don't verify that information with a site visit or a follow-up inquiry or the use of an independent third party to investigate. So this is all self-reported information. However, we do subject it to quality control protocol. And we do aim to make sure that the information that we collect is describing as best as possible and as accurately as possible the information that was provided to us. But ultimately, NPIC data is not intended to be legally enforceable, legally defensible, or to be used for enforcement. NPIC data is also anonymous because calls to our hotline are by design anonymous so that we can provide the best quality service to the greatest number of people. That means that if you request our data, that you're not going to get the names and contact information of the people that place those inquiries. So here's what the basic process of data collection from the NPIC hotline looks like. So first, someone calls our hotline and they speak with a pesticide specialist. That specialist is going to collect those key elements of the conversation and other information onto a paper log. And after that call, the information from that log is then entered by the specialist who handled the inquiry into our custom database, the PID database. And from there, it's going to undergo several layers of quality control procedures before it is considered final in the database and might be custom to data queries and reports. So anytime an inquiry is made to NPIC, we categorize it in one of three different ways. Those are three types of inquiries. The first is considered an informational inquiry. And what that means is this is most inquiries to NPIC. And they're any question about pesticide or related issues like pest control topics. An informational inquiry might be about a specific product, or it might just be about pesticides in general. For example, someone might call to talk about the pros and cons of buying organic produce. And that question like that is not about any specific pesticide, it's a broader topic. The second type of inquiry is what we call an incident. And as I mentioned before, we'll have a section about this a little bit later on. But to introduce it right now, what an incident is for NPIC is essentially any inquiry that involves either an exposure to a pesticide, an adverse effect from an application, or something else that went wrong, like a spill or a misapplication. And an incident needs to involve a pesticide. However, sometimes the specific product is unknown. It might be an incident involving an unknown pesticide product. Again, I'll expand upon this a little bit more in a few minutes. And the third and final type of inquiry category that we use here at NPIC, we call it other inquiries. And those are essentially wrong numbers, something not related to pesticides. Sometimes those truly are a wrong number. But other times a caller, in fact, did seek us out, hoping that we could provide risk information about sort of adjacent topics, maybe about pollution or environmental contamination, but they're not pesticides specifically. And we don't have particular expertise in those areas, but we do still try to use our training to point them in the right direction. And so the type and amount of information that ends up in our database is going to depend on if it's an informational inquiry, an incident inquiry, or another inquiry. Incident inquiries typically generate the most amount of data because for those we collect the most detail. And so for all inquiries, NPIC aims to collect the essential elements. We collect information about who the caller is and other key people involved in the scenario. So that might include information about the caller's profession if that's relevant. We collect as much information as we can about products involved, ideally an EPA registration number, but it's also common that callers do not have that on hand. We describe other relevant details about the timeline or when a product was applied. And we do strive to get the zip code from all of our callers so we can keep that location in our database and so that people can query our database based on zip code, location, and state. And of course, we document what is their question, what's the main context of the situation, and why did they call? And you'll notice that no names or personally identifiable information are collected, again, because we are collecting anonymous data from our anonymous calls. So this chart represents a numeric count of the type of person, the type of inquirer who contacted NPIC in 2022. And so the next few slides, I'm going to show a little bit of data, and this is all our 2022 data. So looking at the type of person that contacted, it can help you identify the audience. When we record the type of person, this refers to the person in relation to that scenario. So for example, if a nurse calls the hotline, but they're just calling about bedbug control in their apartment, we're not going to mark them as a medical personnel for the purposes of our database because they're not calling on behalf of their role as a nurse. On the other hand, if that same nurse were to call our hotline to obtain treatment information for a patient, or because they're concerned about workplace exposure to antimicrobials they use on a daily basis, then those people would be described as type of inquirer as medical personnel. And you can see that, again, the majority of folks that are contacting us are general public, but there's a smattering of other professionals that do contact us regularly. So we also categorize the caller's main questions, and there may be multiple questions per call. Our top 3 questions year in and year out tend to be the same, and 2022 is no exception. So the number 1 question is always about health concerns for people and pets. After that, pest control tends to be the top question, and followed by proper application methods. Other topics that we hear about fairly regularly include regulation topics, how to clean up after a spill, concerns for the environment, medical treatment, and increasingly financial assistance. So that would mean, how do I get financial assistance for pest control or remediation related to pesticide use? And sometimes NPIC callers, or sometimes callers to NPIC, call with the specific intention to report something to a proper authority. So you can see that on this graph as report an incident, which happened 232 times in 2022, about 3% of the questions asked. So anytime a caller wants to report something related to a pesticide, that almost always means we're going to be providing them contact information for their state lead agency to make that call and report that concern to the proper authority in their state. However, we also commonly refer people to their state lead agency in other contexts too. A lot of time callers make a call to us and they're not aware that there are pesticide regulators in their state, right? And so we're able to explain to them the role that the state lead agency fills and provide them contact information to discuss their concerns or bring up incidents they want to share with the state lead agency. So we do make that referral quite frequently. And NPIC does categorize the type of information we provide. So that includes risk reduction tips, documents mailed or emailed, and then again, the contact information that we provide for outside organizations. And in 2022, NPIC specialists gave inquirers contact information for outside agencies over 5,000 times. The most common referral is often to a manufacturer for someone seeking help with their label, help understanding their label. But after that, county extension is a very common resource for us to share, and the state lead agency. We gave out state lead agency contacts to NPIC callers 586 times in 2022. All right, so now we've talked a little bit about the data. I want to talk a bit more about NPIC pesticide incidents. And incident data tends to be the most popular type of data with EPA and others who request NPIC data. And like I mentioned before, we do collect higher quality and higher detail of data when it is an incident. So what is an incident? So I understand that there are different specific definitions of pesticide incident, especially for state lead agencies, that are not the same as what NPIC means when NPIC says an incident. So I want to make sure that that is clear to everyone. So when I'm talking about incident and NPIC incident, we're talking about the specific definition that NPIC uses that's unique to our organization. And we use a pretty broad definition for incident. It includes an unintended exposure for humans or animals. So that could mean someone spilled something on themselves, maybe a dog ate an ant bait trap, or someone went outside when there was an aerial application happening at a neighboring farm and had drift and noticed drift on themselves. An unintended exposure, right? It didn't mean to happen. It could also mean an intended exposure if there is an adverse effect. What does that mean? Why would someone intentionally expose themselves to a pesticide? Well, think, for example, of an insect repellent applied on the skin. So if someone uses an insect repellent and an adverse reaction occurs after that intentional use, we would end up recording that as an incident in our database. Anytime a pesticide is spilled into the building, in the yard, in the garage, we would count that as an incident, and also a misapplication. And of course, a misapplication has a very specific definition because it implies the label was not followed. And remember that our data is self-reported, so we're not alleging that that an incident or that a misapplication in fact occurred. But we are saying that there is some, from what we are hearing from the caller, it sounds like the label may not have been followed, right? And we do typically require an EPA registration number in order to access a label for us to code a misapplication in our database. But there are a few exceptions. We don't always require an explicit label. So one of those exceptions would be misapplication of mothballs, because we understand that mothballs are intended for use in an enclosed, airtight container only. So when we're talking with someone, we often have enough information about the use pattern to say that we think the mothballs were not used according to any of the known label uses for that product, right? So we might code a misapplication if someone tells us they distributed mothballs around in the garden, for example, even if we don't have that label. And the other main exception to the rule of needing an EPA registration number to code a misapplication would be when the user tells us specifically how they misapplied it. So an example could be, well, I applied it in my living room and then I checked the label and I saw it says outdoor use only. Okay, they're telling us explicitly what they did to violate the label. And in that case, we would code it as a misapplication. And so that's the NPIC definition of an incident in our database. And about typically between 16 and 19% of calls to the NPIC hotline end up being coded as an NPIC incident, meeting any of those above criteria. But please note that an incident by NPIC definition is not an allegation that FIFRA has been violated. It merely means it meets one of these criteria on the screen. And we do collect more detail when an incident is reported. So beyond the basics that we collect for all inquiries, we also are going to collect the type of incident, meaning was it a spill, did it happen on the job, was it drift, etc. We document the who was exposed. This could be humans, pets, wildlife, or an environmental entity like plants or a building. And we do ask for a description of the symptoms, including how long they lasted, their duration, and onset. And we do aim to collect information about the location, and then additionally demographic information. And of course, anything else relevant to the call. A lot of times there's additional context that's going to be specific to that situation. Now, sometimes when callers are calling the NPIC hotline and they are reporting an incident to us, sometimes that means time is of the essence. So we don't always have the time to record all of this information, but we aim to collect the bare bones, the essentials, and then focus on when time is of the essence, focus on helping the caller do what's appropriate for them. So that might be taking steps to stop an ongoing exposure, going and following the first aid directions on the label, or calling poison control. And here's a list of the data codes we use to describe entities involved in incidents. So these are the people, animals, or objects who were exposed. And an incident can result in more than one incident entity. So if someone calls a hotline and describes an exposure that affected them, their children, and the dog, we have multiple entities involved in that scenario. And this chart here tends to be the typical breakdown for NPIC incident entities. We see roughly about half of all the incident entities are humans, and then about a quarter end up being non-human animals, which includes pets, livestock, and wildlife, including bees. Bees could be managed or wild, of course. And then the final quarter of entities are typically environmental entities, which is environmental includes the natural environment, but also the built environment like a building or a road. Incident location can provide good information for a data search and a good way to understand the patterns of things we're seeing. So as you can see here, the majority, over 3/4 of incidents that we heard about in 2022 occurred either home inside or home outside. So that means home inside the home or in the yard or garden. And that is not surprising considering our main audience is the general public. But we also see another common location is what we call the ag-urban interface. And this is our way to describe where a residence or a neighborhood meets an agricultural area. And that those incidents made up 8% of our incidents in 2022. And if I'm running through any of this information too quickly, feel free to email me after. Happy to send you a copy of any of this data and these slides. So here's an example of an NPIC narrative. I included this to give an example of what our written case narratives look like. Not necessarily for you to read the whole thing, but like I mentioned, all of our inquiries are accompanied by a written narrative in addition to the data codes. And we think these narratives make NPIC data pretty unique because they help provide important context, like the sort of conditions that are leading to exposures. And we aim to have the data coding, so those things I just kind of went through, the type of person, the location, et cetera, those codes mirror all the information in these narratives. But when we run data reports, there is the option of us providing you with just the coding itself or the coding with the narratives, that accompanying narrative write-up. And the narratives also give us the opportunity to query our data set based on keywords, which can help us pull up specific information that might not have otherwise fit into a specific data code category. Example for that would be COVID-19, when we started getting a lot of inquiries related to COVID-19, and we can go ahead and search for words like COVID, virus, pandemic, et cetera. And so how does NPIC characterize reported symptoms? Well, specialists assign what we call a severity index to any human or animal entity who is exposed to a pesticide. And this index ranges from asymptomatic to minor, moderate, major, and then death. And then also unknown if the symptoms were not known. So when assigning the severity index, the specialist accounts for the duration of the symptoms, the type, and then also if medical treatment was required. And we use two separate sets of criteria, one for human entities and one for non-human animals. So for humans, the criteria that we use are adapted from a system used by poison control centers in their national poison data system and by the US EPA in their incident data system. For animals, non-human animals, the criteria were adapted from a system used by the ASPCA Animal Poison Control Center, in addition to EPA's incident data system. As you can see, the majority of incidents result in symptoms with minor severity. So furthermore, NPIC characterizes reported symptoms with something called a consistency index, or a CI. And this is an estimate by NPIC as to whether the signs a caller reports are consistent with what you could find in the literature for that active ingredient or active ingredients. So we go to the literature and look for symptoms, and if we find reports of a similar symptom in the published literature with reasonably similar root onset and duration, then we will mark it as a consistent symptom. However, if we don't find reports in the literature, then we will mark it as inconsistent. You might notice there's also a consistency index of definite. That only applies if confirmed laboratory results are submitted as part of an inquiry, and this is extremely rare. As you can see, no cases in 2022 were assigned a CI of definite. I need to note that in 2022, NPIC changed the name of this index. It used to be called the certainty index, and now it's called the consistency index. And that was to more accurately reflect the purpose of the index, because we received feedback that the word certainty was confusing because we don't conduct investigation and we're not verifying that an exposure was the certain cause of any outcome. So we changed it to consistency index to better reflect what its intended purpose is. However, the criteria and the classifications used for consistency index now are the same as those that were used for the certainty index. We only changed the name. And finally, we do routine quality control of all of our data. So you heard from Kaylin earlier. She is NPIC's QA specialist right now. So first we have a PID interface that includes automated checks on certain common errors when people enter that data into our database. And then secondly, our QA specialist reviews all incident and then certain select informational inquiry logs, making corrections as needed to help keep our data consistent with our guidelines. Then there's a third layer of quality control from Dr. Fred Berman. Currently, he provides this layer of data quality control for us. And he is based at Oregon Health and Sciences University, and he provides additional quality assurance for all of our incident data. And then in addition to all those formal procedures, we do have ongoing activities that just support consistent and quality data among our pesticide specialists. Because much of our data is qualitative, it is important to establish clear guidelines and have continuing, ongoing education on the guidelines to keep that coding consistent over time. All right, moving right along. For the last section of the webinar, I want to talk a bit more about requesting NPIC data. So who can do it, how you can do it, and what are some examples of data requests that we've fulfilled in the past. So what can NPIC data tell us? So as I mentioned, NPIC calls are mostly from the public, from the general public, and therefore most NPIC incidents and calls relate to problems or concerns in or around the home. So with that in mind, NPIC data is particularly robust for information about the concerns or problems or incidents happening in residential settings. So you might look into our data to see what kind of circumstances are leading to exposure in certain scenarios or location. How serious are the incidents being reported? We can search by that severity index for, incidents with major severity or moderate to major severity. And how many incidents are being reported? And you might be interested in that for a specific active ingredient, products, or type of pesticide class like antimicrobial. And is that rate changing over time? Similarly, is there a changing trend in active ingredient use? And that doesn't have to be just for incidents. This could also include what kind of inquiries are we getting, right? What is the public concerned about right now? What are we hearing about from the public? Is there any particular trend or product or ingredient we're hearing more about? Similarly, a lack of reported exposures or information can also be telling. Are we hearing about anyone about a certain type of product or exposure? And finally, NPIC data often reflects and changes with current events. So, what kind of hot topics are out there right now, or what kind of forces in society are driving pesticide use and exposure? And so, of course, we saw many increased calls about disinfectants incidents related to people using products to control COVID. over the past few years. And we also heard from teachers and parents related to disinfectants and wipes used in the classroom. So someone might be looking for information about questions related to schools during the pandemic. And that might not only include incidents, it might just include general questions or concerns. You know, parents are reporting that their kids are being asked to bring disinfectant wipes to school. What does that mean? And just to reemphasize, because we have those narrative write-ups for each of our inquiries, we can query our data based on keywords and phrases, and that can be especially useful for detecting kind of these new trends. So here's a few examples of some recent data requests relating to kind of current events. So Seresto pet flea and tick collars have been in the news a lot in the past couple of years. And of course, we've heard a lot from the public about them. And we did fulfill several data requests related to those collars. Another example more recently was we recently received a request about a illegal product, Sniper with DDVP, that is suspected to be, being illegally distributed. So we were able to search by that product name and keywords for Sniper to fulfill this report and help EPA understand the extent of the use of non-registered pesticides in a certain area. And I think this is pretty neat. This happened a few years back, but the Cornell Cooperative Extension and New York State IPM program requested 20 years of NPIC incident data and created pesticide profiles for all of the active ingredients eligible for minimum risk. I should restate that. I'm not sure it's all, at least a select list of active ingredients eligible for minimum risk. And they generated from that these minimum risk pesticide profiles, which I find to be very useful resources, especially for things like essential oils. And we at NPIC now are using these to help us out during our calls. So those are a few examples of specific data requests, but common search criteria that we get for data requests include things like all incidents with a severity index of moderate, major, or death, all incidents related to a specific product or active ingredient, all incidents in a specific state, sometimes, or you could just request all inquiries during a specific time period in a certain area to get kind of just a zoomed out look at what's happening there. All occupational incidents, and we define an occupational incident as someone using or working around pesticides as part of their job. So that doesn't just mean farm workers and professional applicators, though. It could also include things like janitorial staff and healthcare workers. And of course, all incidents in a specific location, like vehicles or the agricultural urban interface that I talked about earlier. So how do we request data? And who can request data? Well, anyone can request NPIC data, but we do provide data reports free of charge to EPA personnel, affiliated state and tribal agencies, and to our, extension PCEPs, kind of university partners like that. And we do provide reports within 10 business days for those parties. However, if anyone else wants to request our data, including the general public, the media, registrants, nonprofits, they may also do that. And we will just ask them to go through Oregon State University's public records request process. And there may be a fee associated with it. And how do you do it? Well, I tried to make a compilation of the most straightforward ways to get a hold of us. So first of all, you can contact our EPA project officer. Her email is up there, Ana Rivera Lupianez. And if you do work for EPA, you can access a form to contact us through the intranet. And so that link up here for the EPA intranet is the recent up-to-date link as of February 2024. Of course, you do have to be an EPA employee to use that link. And other folks can contact NPIC directly. You can contact me. Here's my email up there. Our director, Sirhan Murmur, you can contact him as well. Or you can contact our our general NPIC inbox, npic@ace.orst.edu. And that general NPIC email is going to be the best way for, media, industry, NGOs, et cetera, to contact us. And that email won't change over time. What is the format of the data request? So we'll provide you with any data related to your search query parameters. And again, our data is by policy anonymous, so it won't include personally identifiable information for inquirers, but we will give you all the information we have associated with what you're looking for. The data can be provided in one of two formats. So it can be a PDF, and that's going to include those case narratives, all the write-ups, and each inquiry has one write-up. So those provide a much higher level of detail, but as you can imagine, they're much more time consuming to sort through a narrative write-up. It will also have the accompanying data codes with each write-up, but that can be much more time consuming, especially for a larger data set. Alternatively, we can provide data in a CSV format that can be imported into Excel or similar programs, and that doesn't include the case narratives. It only includes the data codes assigned to the inquiry. So that format might be useful if you're working with a large data set, or especially if you're looking for counts of certain information, like number of inquiries related to a certain active ingredient, number of cases of ocular exposure related to a certain product, etc. And you can request both of those formats or a custom format. We'll work with you. All right, quick review of the data request process. So you'll contact NPIC. We'll work with you. Me and Sean Ross, our database developer, will work with you to refine your request, and we'll use our best judgment on how to provide you with the best results for what you're looking for. You can request either as a PDF or a spreadsheet with the data codes, or both. And if you're part of EPA or affiliated state agency, we'll get you that information within 10 business days or fewer. And we do provide follow-up or assistance for helping you interpret the data, or if you need to refine your request and make an additional request, we'll help you out with that. All right, getting close to the end here, I just want to explain real quickly that we do have 2 additional online reporting portals. And those are ways that pesticide incident data can be submitted to NPIC. So the first is our Veterinary Pesticide Incident Reporting Portal, or the VERP. This is intended only for veterinarians and their staff to report adverse effects to veterinary products or adverse effects to pesticides. The second is the Ecological Pesticide Incident Reporting Portal, and that is only for reports of wildlife incidents. And both of these were created in collaboration with EPA. And NPIC does submit all the information generated from these portals quarterly to EPA, but we keep it separate from NPIC data. That means it's not subject to quality control procedures. And of course, again, it's not intended to be used for targeted enforcement. It's for information only. All right, so that's it. I'll just do a very quick review, and then we'll turn it over to Q&A. So NPIC operates a toll-free hotline. All calls to our hotline are anonymous. The data is self-reported, but we do our best to accurately record the information that people report to us. Our website maintains a My Local Resources directory that has thousands of relevant pesticide resource contacts nationally. NPIC inquiries can be incident, informational, or other. And our NPIC incident has that specific definition that I went over that might not be the same as the definition you use in your organization. We record all key information for all calls to NPIC, including a written case narrative. And EPA and state partners can request that data for free from us at any time. And yeah, we'll be happy to work with you to help customize your data request moving forward. So that concludes the informational portion of the webinar. And now I'm happy to address any questions, and I'll turn it back over to Kaylin to help moderate that. So thank you.
Right.
So we have a number of questions in the Q&A.
Yes, we got lots of questions. So, let's see. So one of the first questions we got was, do you tell people what's on the label? If the law, oh, let's see. Do you tell people what's on the label is the law if it is a registered EPA product?
So I'm not sure I quite understand the wording there, but we do have a conversation with people constantly about how the label is the law, as I'm sure you can imagine. We don't read information off of the label that we can pull up on our end. We want to make sure that they are reading it for themselves in front of them. So when we are helping people navigate a label, it might look like us saying, hey, do you see somewhere on there that says keep out of reach of children? Can you find, we'll describe to them what the signal word is and help them understand what that signal word means, for example. But we're never telling them, here's what your label says. That is a hard boundary that we don't cross, because we know that they might have a state approved label that could look different than the federal label that we have access to in our database. So hopefully that answers the question there.
And so a couple questions related to who we communicate with. So first, we have a question on, do we communicate with poison control for additional information? So we'll start with that.
We don't, no. So we will we will tell callers the contact for poison control, but we don't conduct follow-up with poison control about the outcome of any situation. We do have a partnership with the kind of parent association of all poison centers across the country, but that's not, that's more related to doing outreach rather than sharing data or doing follow-up.
So we also have a question on, do we tell callers to report possible misuse to the State Department of Ag or EPA, or do we forward these reports to the State Department of Ag or EPA regional office?
So I believe I mentioned earlier, we do not do reporting to state lead agencies. But yes, absolutely, we tell people to call their state lead agency when they are discussing something with us, like a misuse or potential drift, anything concerning. So I think I mentioned that in almost 10% of calls that we received in 2022, the NPIC specialist that took the call ended up giving that caller the contact information and encouraging them to call their state lead agency. But we don't communicate directly with the state lead agency on anytime we get that report. It's up to the caller to make that phone call. We do have certain established criteria with EPA where we provide automatic notification of when certain types of incidents meeting certain criteria occur. And we do report that to our project officer.
So let's see, so in some instances, tribes have jurisdiction over the state lead agency. So how would you describe our relation with tribes when it comes to referrals?
How would we describe NPIC's relationship with tribes? So we're typically going to be referring someone to the state lead agency, and then from there, it's going to be up to the state to say, actually, we think this is in tribal jurisdiction or whatnot. Because we're not regulators, we really can't keep up to date with the regulations for 50 different states. And so we really rely on state leads to kind of handle the nuances that might happen there, right? So we do our best to get people that call NPIC to call their state lead agency anytime they're reporting drift, misapplication, occupational exposure, things like that. But again, yeah, we don't have the capacity to understand the rules and regulations for all 50 states in that jurisdiction.
Do you track incident reports on tribal lands?
So I'm not sure exactly what that question means, but we have in our database zip code location for every inquiry. So we could run a query based on location for incident reports. So we could create an incident report based on the location of a tribe, based on things like zip code and whatnot.
And in reference to data requests, does the process for requesting data apply to tribal programs that operate under a cooperative agreement with EPA?
So if you are, if you're part of a tribal government working with EPA, or not, any government agency can reach out to us directly, and we will fulfill that data request for you. So if I'm understanding that correctly, yes, the data request process would be the same. You can reach out to our project officer. You can reach out to me directly, whether you're representing a state, a tribe, or EPA.
Okay, so we got a couple questions about the content of our calls. Do we track anything regarding pesticide inner ingredients?
We do not, and yeah, it's difficult. We don't typically have knowledge of what inert ingredients are in any given product ourselves, and so yeah, we've gotten used to having that conversation with callers about. Unfortunately, we know there's other ingredients in this product, and we don't know what they are, but it's possible they could be contributing to X, Y, or Z situation that the caller maybe is struggling with, but we don't do additional tracking in that way because we don't really have a mechanism to do that without knowing what all those ingredients are.
I will also mention, speaking as an NPIC specialist, we do have a way to code that the caller was asking about inner ingredients. But in terms of the specific inner ingredients, we aren't able to track that, as Meredith mentioned.
Yeah.
Next question. When answering a health question, how do you characterize the potential health impacts from risk or toxicity of the product?
That's a good question. And we do a whole training on our risk communication program. Every conversation is going to look different. And Kaylin, feel free to add anything to my answer. But yeah, we will follow the risk equation, right? Toxicity times exposure equals risk. And we usually use that as the foundation of the callers or of the way we communicate those health effects. But sometimes someone just wants to know what is possible. And so then we'll go into our fact sheets or the literature and say, well, here's symptoms that have been reported and related to this active ingredient or exposure. But it's very nuanced, and that's a pretty big question. Like I said, we have a whole training program that we put everyone through to kind of understand how to have those nuanced conversations. Do you have anything you want to add, Kaylin?
No, I think that that captures a lot of it. I mean, it's the only thing I'll add is that each conversation is very unique. So one conversation we have about risk with one particular calls might vary a lot from another call. It's really situation dependent.
Yeah, absolutely. It's not one size fit all, but we do try to stick to the risk equation, looking at toxicity and exposure, but that can look entirely different if someone's concern is about cancer risk or developmental risk or reproductive risk, right? And so, yep, it's a big topic. Thank you for asking.
So what do we say to those requests for financial assistance? The EPA gets a lot of those questions as well.
Yeah, that's a tough question. And I wanted to share it just because I'm sure we're not the only ones hearing about it. But it does seem to be on the rise. Unfortunately, we don't have a good response ourselves. I wish we did, right? But since we don't provide financial assistance, we can't help with that. Well, we'll say, unfortunately, I'm not aware of any resources, but we do like to remind people of things that might exist, like 211 to help people find wraparound services or things locally that we might not be aware of on a national level. But yeah, we do try to help providing the information we can, right? A lot of times if it's a concern about bed bugs, that's a really common one. people looking for help paying for bed bug treatment. Well, at least we can describe a lot of things that person can do that don't cost money, right? A lot of IPM tips and other things that people can do where they don't have to hire a professional. But it's tough. I don't have the answer. I wish I did.
Let's see. So in terms of reporting, how many of your adverse effects calls to pets get reported by veterinarians?
You know, not many. And I can go back to our slide on type of inquirer. So in 2022, only 17 calls came from veterinary clinics. So yeah, it's mostly people calling on behalf. Again, most of our audience is going to be the general public. And again, we do get some inquiries through that veterinary incident reporting portal. But those numbers are probably about the same, not too high. Yeah, it's mostly the general public calling to report. And sometimes they're, they've already been to the vet, they're calling to report something that's already happened and concluded, but they just want it to be on record. That was very common with Seresto collar adverse effects.
Do you have a sense of how many people are reporting exposures to NPIC versus other local or state agencies? And do we know if that's changed over time?
That's a really good question. I wonder if Sean, if you have any input there, please chime in. But we are tracking our own inquiries, of course, and so we know how that's changed over time. And people that are, anytime we document an inquiry or an incident or adverse effect into our database, it's very possible that same adverse effect is also being reported to a manufacturer or to the state lead agency, right? So there could be duplicate reports going on that way. But yeah, I don't know the sort of percentage. Our call volume is much lower than, say, for example, poison control. So I have a feeling that there's a much higher percentage of incidents going to poison control nationwide due to their volume of calls.
We also have a question on if we have any reports of adverse effects or misapplications of pesticides sprayed on boat docks or boats.
Oh, that sounds like a great data request. You should get a hold of us and we can look into that for you. I don't know offhand. I know that and Kaylin, chime in if you've heard anything. I know I've had at least someone ask, can I use a product? I think it was sulfuryl fluoride. Can that be used to fumigate a boat on a dock? But I couldn't say offhand. We'd have to look into that for you.
Let's see, we maybe have time for one more question. Let's see. So someone asks,
how many questions are there left?
There are a few. And so we can answer them now, or we can make note of the question and email them directly. How would you like to go about this?
No, we can try to get through a few more.
Okay.
Do another 5 minutes or so.
Yeah. So does the caller know that we are categorizing a misapplication?
That's a good question. So I guess callers don't know that we are categorizing all of our data in the various codes that we apply to it. So in that way, no. But if someone is calling and saying, I just used this pesticide on my tomato plant, right? And we look at the label and we notice there's no approved uses for tomatoes. We're going to have the conversation with them and tell them, hey, I looked at the label and I noticed there's not any approved uses for tomatoes. Encourage them to verify that themselves, but we'll have a conversation with them, letting them know that they may have misused the product, and that means there are unknown risks associated with it. So we do have that conversation quite a bit about how if a pesticide is not used according to the label directions, then those risks haven't been evaluated and we don't know what's going to happen. Kaylin's had that conversation, you know, so many times, I'm sure. I know I have. And so while we're not explicitly saying we're going to enter this into our database as a suspected misapplication, we will tell them if we think that something has been misapplied so that they can be aware of the potential risk inherent with that, if that makes sense.
Let's see.
Yeah, and feel free to send us an email. Let me scroll back to where my personal email is right here, Meredith Cox. Feel free to reach out to me directly at my email address if you have additional questions that we don't have time for today.
So someone's asking about the training on risk versus toxicity, and they're wondering if that training is available to attendees.
Oh, that's a great question. Not at this moment, but we have given that training a lot in the past. I'm sure we'll do it again. And if we do have a recorded version of that ready to go at some point, we will absolutely be, you know, sharing that with EPA and with the states for that to go around. Yeah, I'm sure a number of folks on this at this meeting have attended our risk communication training in the past. It's been something we've given at a variety of conferences and whatnot. But yes, if we have that available, we will let you know. Thank you.
All right, so we are a few minutes past noon. There are still some questions left. So how would you like to go about this?
Let's see. Yeah, why don't we take a couple more, and then if we didn't get to your question, feel free to email me. And I'll get back to you that way.
Okay. Let's see. So someone would like for us to confirm that quarterly NPIC shares all incident data reports with EPA OPP. They refer people to NPIC for EPA to capture incident reports.
So we share quarterly reports that are summaries of all of our data with EPA. And so that doesn't mean that we share our whole database with EPA quarterly. We share those kind of summary statistics. Yeah, so it's not the database in its entirety. So if someone wanted a quarterly review of the database, then they would need to reach out to us directly, and we could get you that report.
Okay. So someone mentions that as they recall, some of the info on the website related to rodenticides doesn't seem to be kept up to date. Are we updating those pages, or do we have a status of those pages?
Yeah, I don't know what specific pages you're referring to, but if anyone ever is on our website and see any information that seems out of date or incorrect, please reach out to us. Contact our main email address, the npic@ace.orst.edu, or reach out to me or Sirhan via email directly, or our project officer. There's lots of ways to get a hold of us. You can even call the hotline. Because we want to know. We do strive to keep that up to date. And we do have active ingredient fact sheets for several dozen active ingredients. And those are, you know, documents that we put a considerable amount of effort into, but they are hard to keep up to date. You know, the literature evolves over time, and we can't maintain them always 100% up to date. But if things change significantly, you know, in a real substantial manner, we would like to update that. So reach out to me directly if there are concerns. We appreciate when people do that.
Let's see, someone else asked, why don't vets know about our vet portal?
That's a great question. We've done some outreach to veterinarians before in the past, and we may do it again in the future, although we do find that the level of detail that we can get from having a phone conversation with a veterinarian or a member of the general public reporting an adverse effect, it often tends to be of higher quality when we can have a back and forth conversation with them about the details of the incident, the symptoms, the timeline, et cetera. And that isn't always captured when someone enters information into an online portal. So we do often prefer to have that conversation to get that higher quality and more detail in our database. Yeah, again, we have done some outreach to veterinarians in the past. It may happen again in the future. But we also really encourage people to just call the hotline directly. We can document that incident ourselves as well.
Do we get calls about pesticide treated seed?
Not too many. I myself have taken I think only one incident call related to treated seed, not necessarily, maybe more informational calls just with questions about it. I did get a call once from a woman who had ingested some treated seed and was calling to know what to do. And of course, because it did not have an accompanying label, she didn't know what it was. So we do occasionally get calls on that, but it's not too common. A lot of people find our contact information on a product label. And so since our contact information wouldn't be on the label of treated seed, we wouldn't be hearing from that sort of, I wouldn't be hearing about that as much. But that's a good question. I wonder if we will hear more in the future.
Okay, so we have a question from Donald about repellents. Donald, I'm not entirely sure I understand the question that you typed. I can give you permission to unmute yourself if you are still here and would like to ask the question verbally.
Hello, can you hear me?
Yes, we can hear you.
Yes, I was just asking when you classify different things, most repellents do not permit applications to direct skin. And you mentioned that as an example where you would classify it under on purposeful exposure, adverse, but then it's also could be classified under misuse of the product. So do you put two codes or do you make a decision?
Yeah, obviously that's product dependent, but yes, sometimes there can be multiple exposure types. Obviously, there can be multiple exposure codes for things like dermal, ocular, inhalation might all happen at once. But yes, misapplication and dermal exposure could happen at the same time. That's less common. Usually misapplication isn't happening to a person or an animal, but it certainly does. And yes, that's a good question, and both of those codes would apply.
All right, so I guess the last question is to just clarify how we code questions about inert ingredients. And yeah, you can take that or.
Sure, yeah, and Caitlin, I'm sure you could answer this as well, but so we label it as type of question is about inert ingredients. So there's not a whole lot of detail associated with that code. But when we code the type of question that the caller has, if they're asking about inert ingredients, which might be, what is it? Or why can't I know what it is? Or does it include X, Y, or Z? Anything about inerts, then we're going to mark that as a type of question. That's kind of the extent of it, because, like I mentioned, we don't know what they are. Aside from if we have a label saying there's petroleum distillates in it, beyond that, we wouldn't know what the inert ingredients are, so we have trouble coding it, but we do characterize or identify the fact that someone is asking about inerts. And I can say that the most common question is, what else is in there? And how can I find out what it is? And of course, we will refer people to the manufacturer, but explain to them that ultimately it's a trade secret. The manufacturer might not disclose that with them.
And then
all right.
follow-up question to that was
Mhm.
how many INERT questions are happening? It seems like that would be a good opportunity to request our data.
Yeah, that's a simple question. You can email me directly. I can look that up for the year, you know, for the past year or whatnot. That's something that we generate annual reports that have kind of counts of number of the different, you know, categories of questions and things like that. So yeah, shoot me an email. I'm happy to look that up for you. It's not super common, but certainly conversations about inerts do come up somewhat frequently as part of a larger conversation. Caitlin, would you agree with that?
I think so, yeah. A lot of people often notice that the active ingredient is only a small percent, so they're wondering what's in the rest of it.
Right. Absolutely. All right. Well, it seemed like,
There's
oh,
Meredith,
sorry.
there was one more question in the chat that's slightly different, I think, than what was asked before. I think there was
Okay.
clarification about how, and sorry, my camera's not turning on. On one of the questions was if our data is automatically shared with EPA. And this
Mhm.
there's another question from Royan that asks, are the incident data shared with OPP? And if so, which offices of what frequency? And maybe I'm happy to touch on that. There's some, like Meredith answered, there's summary data sent on quarterly and annual basis, but there's not a big general dump of everything that we get to EPA unless that's specifically requested. But people in various offices, OPP, the most obvious one, or different working groups or departments under OPP, request data. So re-registration folks often do a request for all incidents over some time period, say the last 5 years, for a specific AI when it's going through review and things like that. So though that's when stuff happens that's outside of the quarterly and annual summaries that automatically go out. So I hope that clarifies that. I saw that one was still being open. I don't think it got fully answered, so addressed it.
Yeah, thanks, Sean. Yeah, that's good. Thanks for adding that detail.
All right, well, that's all of the questions. And thanks for those who joined us. Hopefully you learned a lot.
Yes, thanks everyone. And again, we were recording this and we will send a follow-up email with the recording link once it is live. And I'm also going to send a follow-up email asking folks to confirm that their organization's contact information is correct on our website directory. So keep an eye out for that. And thanks again for attending, and feel free to reach out to me or any of us if any other questions come up.